Pain is something nobody wants to deal with, especially if it's ongoing. Chronic pain, if left untreated, can literally ruin your life. And you know what? Life's too short to live with it anyway. I'm at Innovative Pain and Wellness with Drs. Christine Haddad and Dr. Shafik Boyaji. They are offering up many solutions to help you live your life again. And I'm telling you, I bet you guys hear this story all the time, right? Pain, nobody wants to deal with it. So Dr. Boyaji, tell me what's different about Innovative Pain and Wellness?
So we are a comprehensive pain clinic. That's how we define our clinic. We really sit with the patient when they walk to our doors, listen to their story, how they got here, what pain is preventing from doing. It could be preventing from working or even enjoying life, like playing golf or playing cards with their game or traveling to see their grandkids. We will work very hard to try to restore them to the function that they can enjoy life again and be comfortable eating, sleeping, and doing work.
Yeah, you know, Dr. Haddad, when I said it can ruin your life, I'm sure you hear these stories all the time. So when somebody comes in, give me an idea, walk me through the process, if you will, of how you're treating them, how you're helping them, because chances are they've already tried other things, right?
Absolutely. So when a patient comes in for a consultation, we usually sit down with them. We ask them a thorough history about what they've tried in the past, including medications, perhaps physical therapy, perhaps they've had back surgery before, or maybe they've had an epidural or injection. So we go review all of that. We try to get all their imaging available as well, maybe a recent MRI or x-rays, and we review it with them. And based on that information, we kind of tailor the treatment to see what would be appropriate for them next.
So in other words, you're going to listen to me. Correct. Wow. Okay. All right. Let's talk about the ways that you can treat patients. I know there's all kinds of options. You got lots of tools in the toolbox, but let's talk technology. Give me a quick example, if you will, Dr. Boyaji, of what you can do.
So very kind of a new and innovative technology called spinal cord stimulator. I know it's a big word, but to make it simple, I'm sure you have seen people who have pacemaker, which is like a very small battery connected to the wire to stimulate the heart. This is very similar concept, but geared toward the pain. So a small battery connected to the wire that stimulates the spinal cord to block those pain signals. So without doing big surgery, without changing the anatomy, we can decrease the pain levels. And the patient will have a controller, and he can kind of control what setting, control the stimulation, if you could want, and it will help a lot with their pain.
That is an excellent option, but I know you do a lot of other, should we call them procedures? Interventions, right? And that you can do in office. Give me another example.
So other examples would be something called Intercept procedure, or it's a type of radiofrequency ablation that's specifically to treat chronic low back pain. So patients who have been suffering with back pain when they're sitting for a long period of time or bending forward. I have patients who come in and say, I can't lift up my grandkids or my pets. We will review their MRIs and see if they're a candidate for the radiofrequency ablation, where we can zap small nerves in the back to treat pain coming from the disc or the bones in the back. And that's if they don't want something implanted, and kind of quick outpatient procedure where they go home the same day.
I said at the beginning of the segment, if left untreated, it can ruin your life. Can it?
Absolutely.
Yeah. Well, if you can't pick up your grandkids or your pets, right, what's the point, right? And the success rate generally, because you have to find out if they're a good candidate for anything. But give me, tell me about one person and what they said when they left the office pain-free.
Well, I had a patient when he came in for his post-op follow-up from an Intercept. I walked in and the first thing he told me, I love you, you have changed my life. So.
And there you go. That is the end of this story. Oh my gosh, thank you so much, you two. Let me give you some more information. Innovative Pain and Wellness, they have 5 locations across the valley, 480-306-7242 or 480-467-2273. Visit the website to learn more. It's innovativepainandwellness.com.